Hi, everyone. Bob Dietrich here with another edition of the ADHD Toolbox. And today we have a special guest. You may recognize her from the first ADHD Toolbox. It's Elaine Taylor-Klaus. And Elaine has been around for quite a while in the ADHD field with Impact ADHD, which is an awesome resource. If you have ADHD or you know someone or you have children with ADHD, there's so much there. I highly encourage you to go to Impact ADHD and check out her site. She's also got an awesome book coming out this year that she's going to tell us about. But Elaine, tell us, just so we have a little bit of background before we start talking about our topic today, which, by the way, is behavior therapy. And if you're an adult, don't tune out because this is going to be really relevant for you as well as for parents looking for behavior therapy. But Elaine, tell us a little bit about how you got involved in ADHD work, and especially with Impact ADHD.
Sure. Sometimes it amazes me that I've landed here where I am. I started off as a mom, what I would call kind of a neurotic mom of one, then two, then three complex kids.
Mm-hmm.
Somewhere along the way, figured out my husband was also what I now call complex because ADHD often doesn't just fully describe what we're dealing with. There's ADHD, there's often anxiety and learning disabilities, sometimes in depression. There's a lot thrown in. So I like to look at this sort of neurology as complexity, right? So we have a very complex family. And at some point along that journey, after my third child was clearly going to be diagnosed, I went and had myself tested because I kind of looked at my husband and I went, there's no way he can be responsible for all of this neurology. There's something else going on. So then I was diagnosed as well, just around 40 with attention and learning issues myself. So I started I had spent a decade or more trying to seek help to help my kids, but nothing had really been helping or working. And when I was diagnosed, I discovered coaching. And when I started getting some coaching for myself, everything started to shift in my life. And I had some other kinds of experiences with it. I had been a yoga teacher, and that brought me a lot of balance and centering. But the coaching really helped me learn to understand what was going on and gave me some very positive, empowering, effective, practical tools for managing it.
Mm-hmm.
And what I realized was that there was a lot of support out there for kids, and there was, in those days, almost nothing available for parents. And so I went back to school and became a coach, got certified as a coach so that I could work with parents and help parents of kids with complex needs.
Mm-hmm.
And along that journey, after I'd already started a company, I met Diane, my business partner, Diane Dempster,
Mm-hmm.
who had a very parallel experience to me. When she became a coach, she became a better parent. And it wasn't rocket science. It was something that really could be applied and learned and taught. And what was really cool was that I had ADHD, she did not have ADHD, and it worked for both of us. So we knew we were really onto something, something that was a more lasting kind of change. And so we created Impact ADHD initially because we just felt like we knew that parents out there were feeling isolated and alone. And we wanted to create something that gave them support, that gave them access to coaching at whatever level they could use it. We wanted it to be affordable and accessible because we knew it was effective.
Right.
And so we've been curating content and publishing guest experts and, doing coaching programs and training programs ever since. It's been an amazing ride.
And how many blogs do you have on your site? It was like in the hundreds.
Oh, it's over 800. Yeah. It's like, because we've been curating, we got about we publish 3 pieces a week every week since 2011. So it's been a while, and in the interim, we've created some amazing programs. Like we have a program called Sanity School for Parents and Sanity School for Teachers, which we'll talk about a little more because it's a behavior therapy program. And
Mm-hmm.
we do group coaching and private coaching. And then probably about 85% of what we do is free and available to the public.
Got it.
So
when you go to the doctor or maybe you're first getting that first call as a parent, and that your child has some kind of behavioral or learning challenge, and you don't even know you can't even spell ADHD because you don't know what it's about, or maybe you've heard of it, but it's like,
and it's not good.
Yeah, or it's not
right.
it's not going to happen to me.
Yeah.
And you don't know what to do, or maybe you're a parent, right? And not even a parent, maybe you're just an adult with ADHD, you get diagnosed, and you don't know where to go. You start looking for recommended treatments. What are some of the recommended treatments that you've seen out there for ADHD?
Well, as everybody knows, the number one recommended treatment for ADHD is medication.
Hmm.
And there's been a lot of research on adults and kids. And we know that for a significant percentage of the population, not all,
Hmm.
but for a good size percentage, probably about 70% or more,
Hmm.
medication can be effective in reducing symptoms of ADHD. Here's the catch. The other piece that's recommended for both adults and kids is behavior management, because the thing about ADHD is that it's not a disease that can be fixed or cured.
Right.
It is a condition that one learns to manage and navigate.
Right.
And so behavior becomes a significant part of the treatment, because with ADHD, we're struggling with challenges of organization, of emotional management, of an energy regulation or attention regulation, focus, activity. We're dealing with things that all have behavioral implications. So whether you're an adult or you're a kid, you got to learn how to manage yourself to reduce those symptoms. It's not enough just to have meds, because if you take the meds, they may reduce some of the symptoms for a while, but if you don't learn strategies, compensatory strategies or management techniques to help you manage it for the long haul, is the day you don't take the meds, or the day that for whatever reason something changes, you're kind of back to square one, because you haven't learned how to put systems in place to manage yourself.
Got it. Got it. So behavior therapy is key, with or without medication.
Yeah, and in fact, the research on kids, little kids with like under the age of 6, is that the recommended treatment is behavior therapy before medication, because the research has shown that it'll delay the onset of the need of medication, and it will reduce the amount of medication that might be needed for kids. So it's really powerful method for management.
Got it. So can you describe what behavior therapy looks like for adults, and then maybe what it looks like for kids?
Yeah, well, I'll do my best. So, one of the things about behavior therapy is that it's kind of got a vague definition. And the
Mhm.
medical community, as I understand it, has left it that way so that there's not a lot of battling over who and what and why and how. So, generally speaking, behavior therapy is about getting some training. So, it's also known as behavior management training, for parents, parent management training, parent behavior therapy, behavior training. So, it's really about training the person, whether it's an adult for themselves or a parent or a teacher for kids,
Mhm.
how to create an environment that is supportive to help set that person with ADHD up for success, right? So, there are components to behavior therapy, and we'll get to it in a minute. But the concept is, let's look at what's happening in each environment and try to help make it more conducive for that person to be successful. And so we do that by manipulating or navigating the environment. In a school system, it might be an IEP or a 504, or some accommodations, learning shifts to level the playing field. For an adult in a work environment, it may be getting accommodations in a work environment, being able to use a quiet room when there's work that needs to be done that requires focus, for example, in a work environment. So part of it is about looking at the circumstances to help improve our ability to perform in that situation.
Got it. Got it.
That makes sense?
Yeah, yeah. And when I'm thinking about behavior therapy, I'm thinking, okay, so a kid is acting up at school. We need to calm the kid down. We need to get them to focus. We need to get them to stop being aggressive. So we send them to behavior therapy. Um,
Well, you don't exactly send them to behavior therapy.
okay.
So that's the thing. So there's a misunderstanding within the medical community. And I was just at the APSARD conference this year, and this topic came up again and again, because there's a lot of people aren't really clear what's meant by behavior therapy.
Mm,
So let's just focus on kids for a minute. When we're talking about children, behavior therapy generally means training for the parent or the teacher to
mm,
create the environment that where they have structures or systems or strategies they use to support the child, where they have a community where they can talk to other parents and connect and not feel so isolated. So there are components where they have a feedback channel with the provider, whoever's providing the behavior therapy. But the adult is actually the one that gets the training, not the kid.
Right.
Now, there are some people who do behavior therapy with children in an environment. Sometimes that will be effective, sometimes not. What the research has shown that when you take a kid with ADHD and you put them in a talk therapy environment, it's not really going to help their ADHD. It might help their anxiety or their depression, but it's not likely to help the ADD, because you have to deal with that at the point of performance where it's happening. And that's why you train the adult to manage that environment where the behavior or the challenging problems are happening.
Fantastic. That's a great distinction. So if you're a parent out there thinking you're just going to send your kid to behavior therapy and they're going to get fixed, they don't go to therapy. You're going to therapy, but you're going to get tools and tips that are going to make your life a lot easier and help your child.
Right. And to be clear, it's not therapy. Behavior therapy is the term, but it's not actually provided generally or always by therapists. Therapists can provide it, but it doesn't have to be a therapist.
Got it. And then so from an adult standpoint, then you're not, adults don't have parents that are directing them, so they must go there for themselves.
I think the best sometimes, I don't know, I've got a lot of parents of young adult children. Our most recent private client has a kid who's 33 and still failing to thrive, failing to become independent. I think the best parallel to behavior therapy for kids, for adults, is ADHD coaching. Because ADHD coaching does pretty much the same thing. It works with the individual to talk about how do you create an environment to be successful. It gives them a sense that they're not alone. It gives them somebody for feedback. So it's got the same aspects of that a behavior therapy program would for kids, in that it's really helping the adult identify the challenges that they're facing one at a time. So in coaching, you always start by taking aim on something, getting clear on your topic, and beginning to work it. So instead of dealing with organization, which is big and overwhelming, you might deal with, okay, I just want to stop losing my keys. How do I put a system in place so I can stop losing my keys?
Right. And maybe as simple as a basket in front of the door, or maybe a bell on the key, or one of those.
Right. There's all kinds of things you can come up with, but you got to start by setting the intention to address that problem first, and only that problem, before you move on to something else. But if you just want to get organized, that could be really overwhelming.
Got it. Yeah. So when you talk about behavior therapy then, or coaching, or whatever we want to call it, we know what we're talking about. What should be included in this process in behavior therapy?
So I've kind of alluded to it. So the three major components that should be included in a good behavior therapy program. Generally, they go on. It's not a one-shot deal. So you're not going to go visit a behavior therapist or a coach who's teaching it for one session. It's usually 6 to 8 weeks. A lot of the research was at 8 weeks. We've discovered that 6 weeks seems to be even longer than most parents want to sit through anything. And you get a lot of information in 6 weeks. So there's an information component that's usually done in some kind of a class format. Sometimes it's done privately, but that's a lot more expensive. We do it online. A lot of providers do it in person. So one piece is information, and within that information, it's making sure that you set expectations for the parent, so that the parent can understand what's motivating the behaviors that their child is struggling with, or that they're struggling with, so that the parent is able to, what we call, shift expectations, to understand and shift to meet the kids where they are instead of where they want the kid to be, because these kids are struggling with a developmental delay. They are about 3 to 5 years behind their same age peers in some aspects of their development, but not all, which is what makes it so confusing.
Right.
But so when we look at a kid and say, well, he's 9, he should be able to do that. That's not necessarily true, because chronologically he may be 9, but developmentally he may be going on 6 or 7. So one piece that any good behavior therapy program will do is really help a parent or a teacher understand the dynamic, understand what's happening with that child, understand executive function. so that they can begin to
Yeah.
have a little more compassion in their environment.
Yeah. So important.
Yeah.
Yeah.
And then another component is to then give them some strategies to try, something that they can take home, use, and come back and get some feedback. Did it work? Did it not? What do you want to do differently?
Mhm.
So, your classic behavior management systems are star charts or reward charts or that kind of thing. We don't really use them, but because we found that a lot of times parents have them, but they don't know why or how to use them. So we will help parents who want to use them to create them and use them, but we always start a little earlier before the structure. We want to start with really understanding what's going on and why you would be putting a system in place in the first place, right? Because if I give you a bowl to put your keys and your keys are not really your priority and you don't really care about that right now, you're not likely to use that system. So I want to make sure that we're giving you a system that meets whatever your immediate needs are. And so that's another piece, a component that comes in for us, but offering strategies is a general component of behavior therapy. And then a community connection, ability to connect with your peers. If it's an in-person, it might be what's happening in that classroom. For us, we do it online. We have a private Facebook group, a secret group for just our members where they can talk to each other and talk to us and get support from each other. I was joking the other day, I was like from Timbuktu to Kalamazoo, like anywhere in the world, you can talk, there's somebody to talk to. And it's kind of extraordinary. So creating an environment where they don't feel alone, where parents and teachers feel supported, feel heard, and can get some feedback is a really powerful component. So those are your three major components of behavior therapy.
Yeah, and children, especially with ADHD, can have social challenges,
Yeah.
and they can miss social cues. So being in that social environment, start to learn that, sounds like it's super important.
Well, and again, the environment is not for the kid, it's for the parents.
Oh, I see.
Right? It's not the child who would be on this online chat. It's for the parents. Everything we're talking about when we talk about behavior therapy is about focusing on helping the parent figure out how to be a better parent to that child when they're with that child. How do they advocate more effectively? How do they help make breakfast go more smoothly and get out of the house in the morning?
Yeah.
Whatever the challenges are, it's really about the change starts with a parent, not with a kid.
Isn't that crazy? So even I'm going to, it's about the kid, and it's,
Right.
so my people viewing this must also be doing that too. So
Yeah.
that's a great correction. Thanks for that. So who can provide this kind of guidance, therapy, to the parents and adults that are looking for it?
Well, so because the term it's what we provide for parents is behavior therapy training, because actually what's happening is the parent or the teacher are the ones who are doing the behavior therapy by
Mhm.
creating an environment for those kids that helps them be successful. So it's really training, and it can be done. I know some therapists who do it. We've trained a lot of different people to do it. We've trained occupational therapists, psychologists, licensed clinical therapists, or social workers, and then a lot of coaches, and a lot of ADHD coaches and regular coaches are also doing this kind of work. We didn't even know when we started that we were doing behavior therapy, because nobody had ever recommended it, and I didn't even know what it was when I first started, which is kind of sad if you think about it. But we've come so far, and now we know so much more to support these kids and these parents than we did. So it can really be provided by anybody. What you really want is to make sure that they have something behind them, whether they've gotten training as a coach or training or licensure as a therapist. Make sure that they really understand the issues that you're dealing with, whether the kids have ADHD or anxiety or whatever. Make sure that there's some additional training in those arenas. And then, for us, we always say, I won't hire a coach who's not ICF certified. That's the International Coach Federation. So for me, what I'm looking for is someone who has some credential that shows me that they've learned and they're working and they're keeping their credential up. And then the other thing I would say is that there's some programs out there that are, if they're not behavior therapy, they're behavior therapy like.
Mhm.
So we have a program called Sanity School for
Mhm.
parents, Sanity School for teachers, and we train and certify local providers to teach that course in local curriculum in local communities all across the world. Brene Brown has some programs that, while they're not behavior therapy, they would probably be extremely helpful for parents to get their head around these kinds of issues. Ross Green's got some programs around collaboration that are, again, they're not behavior therapy, but they would give parents a lot of the same kinds of information and materials that they would need. And we've sort of worked our curriculum in alignment to make sure that it does qualify as behavior therapy, because we know how hard it is to find it. The other thing I will say is that there are a lot of local practitioners, local therapists in particular, or social workers, who may teach parenting classes that would kind of qualify as behavior therapy. The key is to make sure that the provider really understands ADHD. Because if they do, they will tailor whatever they're teaching to that topic, if that's what you're there for. If they don't, general parenting paradigms and general parenting programs don't always work for our kids. And in fact, they can often make us as parents feel like we're a failure because we're doing what the experts are telling us to do and it's not working. But it's not working because oftentimes traditional paradigms just don't work really well for our kids. So you want to make sure whoever you're going to has some training or credential or something in the realm of neurodiversity.
Got it. Got it. So it doesn't need to be your psychologist or psychiatrist or therapist even. It could be a coach. It could be anyone really who is credentialed and trained in
Right.
ADHD. So this is really like you said, it's a trainer, somebody who's going to train you as the parent how to work with your child, or you as the teacher how to work with your student, or you as yourself trying to train your, work with yourself.
Train your own brain. In all those environments. And it's a great analogy that very much so ADHD coaching is a lot like behavior therapy.
Got it. Or behavior training, probably.
We call it behavior therapy training. That's the language that we use.
Perfect.
But everybody's got their spin on it. So, and it's interesting because if you look at the CDC website, the CDC will tell you that it has to be a therapist. Mm-hmm. There's nothing anywhere, no documentation anywhere that says that. But whoever wrote it from the CDC, because they're human too, made that assumption, and so that's the letter of the law. But there's no documentation to verify that.
Got it. Well, we're just about out of time, but I want to ask this question because I think it's important. What benefits should parents expect from behavior therapy?
That's great. So what we've seen in the research we've done on our program is that it improves parents' confidence. And so when a parent feels clearer and more confident about what to do or how to handle it when they need to say no, or what to do when Jimmy's having that meltdown, or how to handle it when she's pulling her sister's hair, when they feel more confident in how they're responding to their kids, it reduces stress in the household. So that's the other thing we've seen is a lot of reduced stress for parents and for kids. And then you're going to see improved outcomes for kids. When you help kids begin to be successful, as Ross Green says, kids will do well if they can.
Right.
And so if we create an environment that helps them do well, you're going to see an improved performance from the kids. And that kind of has this beautiful cascading impact, because once they start feeling some success, that's going to breed more success and more. And the other thing that I've seen that it really does is it significantly improves relationships between parent and child, sometimes between spouses, because you're bringing a different kind of understanding and compassion to the family dynamic. And instead of reacting constantly to all the upsets, you're now beginning to sort of work together as a team to manage them. And it's beautiful, actually.
Does it improve relationships between siblings?
Absolutely. Well, it has in my household and has for a lot of my clients. But a couple of summers ago, all three of my kids, who are now young adults, came to me. Actually, the youngest at the time was about 16, and came to my husband and me, and all of us, and said, thank you for being coaches, because they have this amazing bond with each other that they see their friends don't always have. And I really think it came from being raised in this environment.
And
Yeah.
I've talked to several families where you have a boy and a girl, and boys can tend to be a little more aggressive sometimes, not always,
Mhm.
and so one of them is so severe with ADHD, maybe have a
Mm.
lot more struggles, that the other one has it also, but it's not as obvious in the
Typical.
household environment. And so by putting these in place for the whole family, everybody benefits from it, even if the parents have ADHD too. So
Especially if well, and we hear from parents a lot, it works for all my kids, even the ones who don't have ADD, or my kid doesn't have ADD, but I use
right.
your stuff. So Sanity School is not specific to ADHD. It's specific to complex kids. So it's ADHD, anxiety. That's the book that I'm writing is about ADHD, anxiety, and more.
Yeah, what's the
Right.
name of that book?
It's called The Essential Guide to Raising Complex Kids with ADHD, Anxiety, and More. And it will be out in July of 2020.
Fantastic. Well, make
So,
sure
but
you
it's
send me.
available now. So on pre-sale.
All right. Well, send me a link to that. We'll make sure we
I
put
will.
the pre-sale link below, and we'll also inform our audience that this is available when it comes out in July.
Thank you.
Sounds like a phenomenal book. I mean, you spent
I'm
so many.
excited. It's kind of the book version of the Sanity School Behavior Therapy program,
Right.
training program. So I'm excited.
And Sanity School is available as a behavior therapy guide. Is that what Sanity
Yeah,
School?
behavior therapy training for parents or teachers. Yep.
Awesome. So that's one of many resources that you can use for that. I'll put a link below this interview as well. You
Thank you.
also have Elaine's free gift today. Make sure you click on that. And if you have any questions for Elaine, you can also email her at the link below at her email address. And of course,
Absolutely.
make sure you visit Impact ADHD. It's a wealth of information, over 800 blog reports on various subjects with regard to ADD and ADHD.
Yep.
So Elaine, thank you so much for being a part of our program and
My
this
pleasure.
valuable information. Behavior therapy is a big deal. In
It
fact,
is.
it is the game changer. Russell Barkley says that the mortality rates with ADHD are higher than heart disease,
Yep.
higher than cancer in this country, and it's
Yep.
also the easiest to manage, easiest to get control of and repair. And you can repair it through behavior therapy or through all the other modalities that we've discussed in this program. So thank you so much for being on our program.
My pleasure. Thanks for asking. It's great to
Awesome.
be here.
And thank you for watching this edition of the ADHD Toolbox. We will see you on the next episode. Take care.